Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, when you go for your yearly physical, you have blood work done. We're going to talk about what labs are done and what they might mean. Also, March is Colon Cancer Awareness Week, and we're going to talk prevention. Also, do you have hand pain? It might be arthritis, and we're going to talk about new treatments for hand arthritis. That and Easter seals are here. My first guest to start us off is my partner and friend of a long time and president of Family Practice Associate, Dr. Keith Applegate. Welcome.
Thank you very much, Jeff. It's good to be back with you again.
And you've done this a bunch of times, so no big deal. But we are going to talk about something we haven't talked about before: is the labs that happened.
Perfect.
I mean, you get the blood drawn, and there's certain things you do and certain things you don't do. But some of the common ones we'd like to talk about. Let's start with CBC, or complete blood count.
Right.
Why?
Well, a complete blood count is a measure of the red blood cells and a measure of the white blood cells. The red blood cells, if we're low on those, that is called anemia. We become tired, we become fatigued, short of breath. And so that's important to know whether or not we are experiencing anemia. White blood cell count is important for infection. We have to have an adequate number of white blood cells to fight off any infections that we come across.
Okay, so that's a CBC, and then another common thing is called a BMP, or a basic metabolic profile.
Basic metabolic profile is just as it says. It's pretty basic. It's looking at your sodium, potassium, chloride levels. It's also looking at the kidney function test. The kidneys are important to excrete poisons, toxins from the body, and the kidneys can be affected by some of the over-the-counter medications such as Advil or Aleve, and so that test needs to be monitored to, especially for patients who are using these products over the counter, because we don't want to take too much of those.
Now also, that's the glucose is part of that and is a screen for diabetes.
Glucose is a part of this panel. In order to determine diabetes, we try to look at that fasting. There is another blood test that we'll look at called hemoglobin A1C, which is a 3-month average of the blood sugar. And many times patients will say, well, how can you determine what the 3-month average of the blood sugar is from that one blood test? And it's done in the laboratory by looking at the amount of the sugar or glucose that's embedded in the red blood cell wall. And from that, you can derive what the average sugar has been for the previous 3 months.
Okay, hepatic panel, or liver.
Liver is also the filter of the body. It filters poisons and chemicals from the body that we may ingest. The number one thing that we think about is alcohol is a poison to the liver. Tylenol, over-the-counter common pain medication. We have to monitor the liver for any potential toxicity. Again, if you take too much, it's a problem. Just like anything else in life, moderation is a good way to go.
And a lot of medicines, including prescription medicines, affect the liver, like a statin, which a lot of people are on.
Well, statins are the cholesterol-lowering medications, that's correct. So we keep an eye on the liver to make certain that the cholesterol-lowering medicine's doing what it's supposed to do, is lower the cholesterol, but also to reverse hardening of the arteries.
All right, thyroid panel.
Yep, thyroid. The function of the thyroid is to regulate the body's metabolism. And many times patients will be complaining of feeling tired or cold, or even sometimes hotter than their fellow friends. And that can be due to the thyroid gland. If it's underactive, we're cold. If it's overactive, we're hotter than everybody else. So it runs the metabolism of the body.
We just mentioned cholesterol, or statins for cholesterol.
Yep.
Lipid panel, lipid profile.
Yeah, lipid, that's looking specifically at the total cholesterol, and we break that cholesterol down into the good cholesterol and the bad cholesterol. The good cholesterol is the HDL cholesterol. It actually cleans the lining of the blood vessels, and the bad cholesterol, think of it as the goo or the sludge, and that's what sticks. So you want a lot of good cholesterol, very little of the bad, and so that's why we look at those panels.
Now those are pretty much the basic, but sometimes you also get into vitamin levels, like vitamin B.
Right. Vitamin B is We get that from eating animal products, whether or not that's eating the animal itself or the byproducts such as eggs. And vitamin B12 is necessary for the body's neurologic system to function properly. If we're low in B12, that can sometimes cause numbness, tingling in the body, particularly the hands, the feet. And sometimes it can affect our ability to recall, our memory. And many times patients will come to us complaining of they're not able to remember words quickly, and it can be a sign of B12 deficiency.
I might need to have mine checked.
Well, I think about that every day myself.
One last one here, vitamin D.
Vitamin D. Vitamin D, the source of vitamin D is from the sun. We see very little of the sun through the wintertime. And vitamin D is necessary for the body to be able to absorb calcium from the foods that we're eating. Our body has to have calcium in order to run its metabolism. If we're not getting adequate amounts of calcium from the diet, the body starts pulling the calcium out of the bone. Over time, that leads to thinning of the bone, known as osteoporosis, makes us more prone to fractures, which becomes important as we become our age. Because when we fall, we don't bounce, and orthopedic injuries can subsequently lead to other problems.
Well, we thank you for all the information you give it. Thank you for all the care that you give your patients. Thank you for your friendship all the years, and we appreciate you coming in.
Well, Jeff, it's always good to be in with you, and I'm always happy to educate, and it's always good to be by your side.
So when you get your physical, you might now know what some of those laboratories are for. We'll be right back.